My name is Michael Cryer. I work with Prisma Health Cardiology with a focus on interventional and structural cardiology. Grew up here in Chapin, South Carolina. Moved here in 2001 and trained at University of South Carolina with my internal medicine residency and general cardiology fellowship. After which I went to New York City, trained at Mount Sinai to do interventional cardiology, and then went to Tucson, Arizona and did structural cardiology. I do general cardiology. I focus on that in my clinic, but my subspecialty training is in interventional cardiology, and that's doing heart cath procedures, interventions with stenting in heart arteries in patients who have chest pain or heart attacks. I also have a focus in structural cardiology where I can fix heart valves with similar types of technology, all minimally invasive and through wires and stents. TAVR is a wonderful procedure. It's an ability to fix a diseased aortic valve, mostly what we call aortic stenosis or tightening of that aortic valve. This is a very important valve that allows blood to travel from the left ventricle into the aorta and to get to all of our organs. And historically, we've only been able to fix it when it's tight with surgery. But now, over the last decade or two, we have an exciting procedure where we can put a new valve in similar to a surgical valve without having to do surgery. We can do it, going through the vessels in the leg and then deploying a balloon that has the new valve on it. So Watchman is a procedure that allows patients to have some protection from stroke without having to take anticoagulation. These are patients who have atrial fibrillation and would generally be taking oral anticoagulation, but for whatever reasons cannot tolerate it or have high risk for bleeding. The device can be deployed in the left atrial appendage and reduce patients' stroke risk and eliminate the blood thinner after 45 days. So I also do ASD and PFO closures. PFOs can be a small hole in the chamber between the left and right atrium. About 20-25% of people can have it, and for most people it's not an issue. Occasionally some patients can have a stroke that's related to this little hole, and we can close that hole with various types of devices that sort of cinch off the hole and can reduce the risk for stroke in the future for patients. MitraClip is a newer procedure about the last decade where we can fix diseased mitral valves. This is an important valve between the left ventricle and left atrium, and it prevents blood from going backwards towards the lungs. And it can, when it's leaking significantly, it can make patients feel short of breath. Well, this device allows the clips or the valves to be clipped together and reduce the amount of leakiness going backwards. Early on in medical school, I recognized that cardiology was a really exciting field. What I love about cardiology is you get a little bit of everything. First off, you get the patient-physician relationship. You get to see people in your clinic and see them, through your whole career, and maybe even generations of family members coming through. But you also get to take care of people when they're sick and in the hospital. You get to see them, on the wards. You see them in the ICU. And what I do in particular, I have the opportunity to do procedures, and I can do really exciting new procedures that replace some of the surgical techniques that existed before. I like to take a standpoint of educating the patient about their diseases that they may have. Doctor is a Latin term that means teacher, and I do think that is part of our job, is to teach or educate patients about their problems. So I'd like to take time in clinic to even get up on the whiteboard, and we'll sometimes draw things out and kind of explain why it's important, to take medicines, or what exactly is happening and why you feel this way. First and foremost, love spending time with my family. I have a wife and 2 kids. They're 8 and 6 years old, at a wonderful age, so a lot of free time spent with them, doing activities, going to various places, vacations. But other than that, I like to exercise, run, weightlift, just to get my mind off work and de-stress. To make an appointment with me, please call the number on the screen.